Welcome to the PEER-OPS training, developed by the Center for Health and Human Services Research at Talbert House. PEER-OPS stands for Post-Entry, Exit, and Recovery Overdose Prevention Services, and is designed to reduce opioid overdose deaths where we live, in our communities, and in our region. The PEER-OPS training does this by training individuals involved in the criminal justice system to 1. Recognize and respond to an overdose event, either while they are residing in a correctional facility or treatment program or while they are in the community. 2. Understand the risk factors for opioid overdose so that they may reduce their own personal risk for opioid overdose and so that they may assist others in their social network to reduce the risk of opioid overdose. And 3. Be prepared to refer others at risk of opioid overdose to community resources. This training is broken into 4 modules that provide background information on the opioid crisis, risk factors for opioid overdose, strategies for responding to an overdose event, and other ways that you might help others to reduce their risk of overdose. In this first module, we are going to look at what has been happening across the country and here in Ohio over the past decade in terms of opioid overdoses. We do this so that we can better understand 1. Why our state and country have been described as being in an opioid crisis or epidemic. 2. The impact of lives lost. And 3. What that means for each of us in terms of what we can do to help combat the crisis. Recent years have seen an alarming increase in the number of people dependent on opioids. For example, from 2000 to 2014, the number of people that died from a drug overdose in the United States more than doubled. Drug overdose is the leading cause of death here in Ohio and has been since 2007. 85% of these overdose deaths are due to opioid overdose. Here we see a map of the United States that shows us the age-adjusted death rate from drug overdoses for each state. What is important to note here is that the dark blue areas represent the lowest drug overdose death rates, while the red areas represent the highest overdose death rates. For example, the dark blue areas experience 2 or fewer deaths per 100,000 residents, while the red areas experience more than 20 deaths per 100,000 residents. This means that the red areas of the country had overdose death rates that were at least 10 times higher than the blue areas of the country. In this map, we see that relatively few areas in the country experienced high overdose death rates in 1999. Over the next few slides, we are going to see what happens to the colors in the map over the next 15 years. Remember that blue is the lowest death rate and red is the highest death rate. Let's look at the same map 4 years later in 2003. What do you see? We see larger red areas in the map. We also see more areas of the country moving from dark blue to colors that are closer to red. For example, yellow areas experience more than 10 deaths per 100,000 residents, while orange areas experience between 14 and 20 deaths per 100,000 residents. There are more yellow and orange areas in this map than in the map from 1999, meaning that the number of overdose deaths is increasing in more states. Here is the map again in 2007. What do you see here? We see much less dark blue and a lot more yellow, orange, and red. The change in drug overdose death patterns is even more noticeable in this map from 2011. Finally, let's take a look at drug overdose death rates in 2014. How many dark blue areas do you see in the map? We see very few areas left in the country with low overdose death rates. In fact, we see large segments of the country in dark orange and red. These are the areas with the highest death rates. While it's important to understand what the opioid crisis is doing to people across the country, it's just as important to understand the impact of the opioid crisis locally in the state in which you live. Did you know that there has been a 472% increase in drug overdose deaths from 1999 to 2013 in Ohio? Think about that for a moment. That is almost a 500% increase in the number of people dying each year due to drug overdose. Unfortunately, this number has only continued to increase since 2013. 2 years later, in 2015, Ohio's age-adjusted drug overdose death rate was significantly higher than the national average. For example, Ohio experienced almost 30 deaths per 100,000 residents, while the national average was just over 16 deaths per 100,000 residents. This means that Ohio's overdose death rate was 83% higher than the national average, putting Ohio among the top 4 states for overdose deaths. If we look at the impact of the opioid crisis in terms of people, We know that we lost 6 people per day on average in Ohio during the year 2013. While we don't have final numbers available for 2016 just yet, some estimates are as high as 11 people lost each day to drug overdose death. So where do overdoses occur? While overdoses occur in private homes, they can happen anywhere and often happen in public places. For example, overdose events are common in public bathrooms, stores, parked cars in public parking lots, restaurants, on public roads while driving, public libraries, and movie theaters. There is even one instance that we will review shortly where authorities believe a child may have been exposed to opioids at or near a public pool. This is a headline from New York. A man lost consciousness in July of this year while driving with his 7-year-old daughter in the car. She then attempted to drive him home. Emergency crews tried to get her to pull over unsuccessfully. She finally came to a stop when she crashed into the back of an ambulance. She told officers that her dad was sleeping, so she was going to finish driving him home. Emergency crews revived the father with Narcan and took him to the hospital. He was later charged with DUI and acting in a manner injurious to a child. On June 23rd, a young boy in Miami, Florida, became ill after coming home from a local swimming pool. He was taken to the hospital and later died. Preliminary tests found a mixture of heroin and fentanyl in his system. The authorities reported that they had no evidence that the boy came into contact with the heroin and fentanyl at his home. They believe that he came into contact with it somewhere between the park or the pool and that he possibly ingested it simply by touching something with heroin residue on it. On this slide, you see 3 headlines from Ohio. In the first one, a mother in Fairborn, Ohio, was charged with child endangering when she overdosed at a party with her child present. In the second one, you see a 36-year-old mother who overdosed in a dollar store with her 2-year-old child present. The store camera captured the child trying to wake her mother, crying. Fortunately, emergency responders were able to administer Narcan and revive the woman. The mother admitted to sniffing fentanyl earlier in the day before taking her daughter to the dollar store to buy diapers. Authorities also found drug paraphernalia with fentanyl residue in her diaper bag, posing a risk to the child if the child had come into contact with the residue. As a result of this incident, the child was removed from her mother's custody. In the third headline, you see a Centerville airline pilot who had flown just 6 days prior, who had overdosed. In this story, a husband and a wife were found by their children the morning of March 16th. Preliminary reports from the coroner established that the cause of death was a fentanyl overdose. The couple were 36 and 34 years old. On July 14th, a woman overdosed in a bathroom stall at Findlay Market in Cincinnati. Bystanders who did not know the woman happened to be present and had Narcan on them. They administered several doses of Narcan to the woman before emergency crews arrived and transported her to the hospital. The woman survived the overdose. So why are we highlighting these stories of opioid overdose? Because we want to help people understand how widespread the problem is and that anybody could find themselves in a situation at any time where they are present during an overdose event. For these reasons, we need as many people as possible trained to respond to an overdose event in order to reduce the number of overdose deaths. We also need as many people trained as possible to educate others about the risks of overdose with the goal of preventing overdose in the first place.
Heroin, even more deadly, 30 to 50 times more deadly.
And right now there is an explosion of heroin laced with the drug fentanyl in Ohio. 9 on your side's Butler and Warren County reporter Jay Warren joins us from Hamilton with the shocking numbers.
If you or a family member is using heroin, the last stop on your bumpy ride, says the Butler County coroner, will be here at the morgue. And now these state numbers coming out about fentanyl means that could be happening sooner rather than later. It's been 37 days since Dorothy Shoemake of Middletown lost her 18-year-old daughter, Allison, to a heroin overdose.
I see something of hers or catch a whiff of her or something, and I'm just broken down again.
Straight heroin, that was enough to kill Shoemake. But now more than ever, heroin is being mixed with the powerful synthetic painkiller fentanyl.
Fentanyl is 30 to 50 times more potent than heroin.
And you can see the number of fentanyl cases in state crime labs exploded in the last 2 years. 387 last year, more than double that this year.
I mean, this fentanyl just increases the risk of death with the heroin, thinking it's heroin. So you take something that's addictive and has a risk of death, and then you increase that 30 to 50 times.
Mannix now says that her office sees more overdose deaths from either fentanyl or fentanyl plus heroin than just heroin alone.
You will end up dead. This kills people.
And sometimes the user is buying straight fentanyl and they don't even know it. How would you respond if I told you that some people, some of it, they think they're buying heroin, they're buying straight fentanyl?
They're buying a ticket right to the grave. They're going to die just like my baby.
The coroner says that this is a game that cannot be won, a game of Russian roulette where your first time playing could wind you up here. Jay Warren, 9 on your side, Hamilton.
So, some of you may be wondering why we're talking to you about the opioid epidemic, especially if you don't have any experience using opioids or may not even use alcohol or drugs at all. But how many of you know people who use opioids or have known a drug overdose victim? How many of you have been a bystander during a drug overdose? Did you know what to do? If you were present during an overdose today, would you know what to do? Because many people would not know how to respond to an opioid overdose, we are offering this introduction to opioid overdose response training. Fatal overdoses can be prevented. Opioid overdoses often occur 1 to 3 hours after the drug was first used, providing sufficient time to intervene to prevent an overdose death. In addition, most overdoses are witnessed. Therefore, it is important to train people who might be present during an overdose event how to respond in a safe and effective manner. Why is it important that we have as many people as possible trained in our communities to respond to opioid overdoses? First, there are many people who don't know how to respond to an overdose. For example, we often hear of people doing things in the hopes of reviving the victim that are not effective, such as putting the overdose victim in a cold shower, punching the victim in the chest, or injecting the victim with a stimulant such as cocaine. None of these methods work and can actually increase the chance of overdose death, either by wasting time or, as in the case of injecting someone with a stimulant, by increasing the chance of overdose death. There are also many people who don't call 911 in the event of an overdose. There are jurisdictions where law enforcement and first responders don't carry naloxone, a medication that temporarily reverses an opioid overdose. This means that you may be able to get naloxone into someone's system more quickly than if they have to wait to be transported to the hospital. Quicker access to naloxone could be what saves that person's life. Similarly, even in jurisdictions where emergency crews carry naloxone, it can take a long time for them to respond. For example, in some rural areas, it can take more than 15 minutes for emergency crews to respond. We have even had some occurrences in urban areas of emergency crews not having naloxone on hand simply because of how many overdoses they have had to respond to in a given day. The PEER-OPS program targets the roles of bystanders, both while inside a correctional treatment facility and while in the community after release from the facility. It teaches people how to help prevent overdose, how to respond to overdose, and how to support recovery and wellness through a peer support role. Welcome to Module 2. In this module, we are going to review some common examples of opioids, and then we are going to spend some time reviewing the known risk factors for opioid overdose. Most people can identify the street drug heroin as an opioid, but there are a number of other opioids which include medications such as methadone and Suboxone, which are used to treat opioid addiction, pain medications such as Oxycontin, Percocet, Vicodin, and codeine, the pain medication fentanyl, which is estimated to be 50 to 100 times more potent than morphine. It should be noted that fentanyl can be absorbed through the skin. Carfentanil, an analog of fentanyl that is one of the strongest opioids. Carfentanil is 100 times stronger than fentanyl and 10,000 times stronger than morphine. Consequently, this drug is not approved for use in humans and is only approved as a large animal sedative. Like fentanyl, carfentanil can be absorbed through the skin. Fentanyl and carfentanil are highlighted in red due to the unique risks that they pose for overdose death due to their strength.
Compared to some of these other drugs, how strong is fentanyl?
It's much stronger, much stronger. You can get a morphine tablet that contains 30 milligrams, and this is what 30 milligrams would look like. If this was heroin, it would be in a dose of maybe 10 milligrams if it was pure. 1 milligram looks like this.
I can't even see that.
Right. And a fourth of this is potentially fatal.
It's 50 to 100 times more potent than morphine and 25 to 50 times more potent than heroin. So a little bit goes a long way.
2 minutes, and you can be in respiratory arrest and be dead. It's kind of like get high and die.
For drug cartels, the extremely potent opioid painkiller fentanyl is a bestseller. For users, it's a prolific killer, so dangerous that law enforcement has to wear the highest protection hazmat suits just to confiscate it.
It can be absorbed through the skin, and it can be absorbed through the eyes, so it poses a threat to law enforcement also.
I don't wish this on nobody. Nobody should have to lose their child like this.
He called and said his heart hurts.
So after taking how many pills?
It was stated, the young man who was there with him, that he had one and the young man had 3.
So just one?
Just one. Just one. This was something that was purposely done. They knew this pill had the fentanyl in it, and they murdered my son.
Butler was one of 10 people to die in just 12 days in Sacramento County alone. And those clusters of deaths are happening all over the United States. Here's just a small sample of what's happening. In Ohio, there were 514 fentanyl-related deaths, up from 92 the year before. That's 5 times the number of deaths. In Florida, 397 deaths, up from 185. And in Maryland, 185 deaths, up from 58.
What are we doing? What are we doing about it? I'm willing to do everything that I can.
The DEA says fentanyl is flowing in record amounts from China through Mexico and into the United States. It's growing.
The trend has indicated that it has right now. It's feeding America's addiction to opioids.
On the East Coast, it's showing up mostly as powder. On the West Coast, it's mostly pills. The pills bring even more danger to the public because often they're a perfect counterfeit copy labeled as other drugs. These all look like what you would get with the prescription.
Yes, and some of them we can't tell. They do such a good job. We can't tell by looking at them.
Whoever's creating these counterfeit pills is versed in chemistry and has specialized equipment.
Someone has gotten a hold of or manufactured the plates for the pill press.
Seems like a professional operation, the way they're doing it.
Yes, they're doing a good job.
But it's killing people.
Yes.
I'm standing up and I'm asking, if you feel you don't have that much strength, let's get together. Each of us, we can build strength. We can make a difference. We have to make a difference.
The influx of fentanyl has served to further exacerbate the risk of overdose deaths in Ohio, with the number of fentanyl overdose deaths increasing from 84 in 2013 to 503 in 2014 to 1,155 in 2015. This means that the fentanyl overdose death rate increased by almost 1,300% from 2013 to 2015. While the presence of fentanyl is certainly a risk factor of opioid overdose and death, there are also a number of other known risk factors for opioid overdose that are important to review. We are going to review 7 risk factors. They are addiction history, social isolation, opioid dose and changes in purity, polypharmacy, previous overdose, chronic medical illness, and abstinence from opioids. Research shows us that individuals with a history of addiction are at greater risk of an opioid overdose. Similarly, those with a current addiction disorder who aren't currently in treatment are at greater risk of an opioid overdose. Social isolation is also a risk factor. What is social isolation? According to the Institute of Medicine, social isolation is an absence of social interactions, contacts, and relationships with family, friends, and neighbors, and may also be an absence of interactions with society at large. Social isolation, as described in the previous slide, is associated with decreased access to treatment for addiction and with depression, which is also associated with overdose. But even people who we may not think of as socially isolated sometimes engage in behaviors that serve to isolate them from others, such as using opioids alone. Even areas we deem to be in the public can represent an example of social isolation or an attempt to use drugs in isolation. For example, using opioids in bathroom stalls of public restaurants or businesses. One estimate is that 1 in 5 overdoses occur in public bathrooms. We also see this trend in community corrections and treatment programs. When overdoses occur on site, the bathroom is one of the most common locations. This type of social isolation, using in a bathroom without telling anyone, is just one of the known risk factors for opioid overdose death. But it may be seen as a high priority risk factor for residents in treatment facilities because those who use opioids alone have little chance of rescue during an overdose event. Therefore, there is one critical role we ask of all residents, staff, and community members. That is, please act as a close friend or helper to someone in treatment and recovery and to those who are at risk for overdose. This means helping to reduce social isolation and to promote access to addiction treatment and recovery activities. Individuals who have taken prescription opioids at high doses are at increased risk of an opioid overdose. When buying opioids on the street, there is no way of knowing the purity of the drug as it is often mixed with other, more deadly substances such as fentanyl and carfentanil. Remember, it doesn't take much of an adulterant like fentanyl to turn deadly. This picture shows an equivalent dose of heroin and fentanyl. Notice that the fentanyl is barely visible in the vial. Many overdoses occur when people mix heroin or prescription opioids with other drugs, such as alcohol, cocaine, antidepressants, or benzodiazepines, such as Xanax, Klonopin, or Valium. This is because taking these drugs together can increase their overall effect, making them stronger than if each drug was taken by itself. Many of the drugs that people mix with opioids have their own overdose risks, so when these drugs are mixed with an opioid, the risk for overdose increases substantially. For example, the more alcohol or downers in someone's system, the less opioids needed to cause an overdose. Even mixing heroin with stimulants, such as cocaine, also known as speedballing, increases the risk of overdose. Some people think that adding a stimulant like cocaine will counteract the sedative effects or risk of overdose of opioids. However, people who mix cocaine with heroin are at greater risk of overdose than people who use cocaine or heroin alone. This may be because the stimulant causes blood vessels to narrow or constrict, which reduces blood flow to the brain and causes the body to use more oxygen. At the same time, the depressant reduces breathing rate. This can be a deadly combination of events. We know that previous non-fatal overdose is associated with future overdose. For example, one 2012 study found that the risk of overdose was 4 times greater for those who had been incarcerated and had experienced a past non-fatal overdose. We also know that many people in correctional facilities or treatment programs have either experienced their own non-fatal overdose or know someone who has. Research suggests that anywhere from 48 to 92% of individuals in addiction treatment have experienced a non-fatal overdose or have witnessed an overdose. This personal shared experience with overdose makes people involved in the criminal justice system and addiction treatment programs important partners in fighting the opioid crisis. If you have asthma or other breathing problems, such as COPD, emphysema, sleep apnea, or other respiratory diseases, you are at higher risk for an overdose. This is because opioids impair the ability to breathe. If you have liver or kidney disease or dysfunction, you are also at higher risk for an overdose. Finally, if you have heart disease or HIV/AIDS, you are at higher risk for an overdose. We know that the highest risk time for a drug overdose for individuals involved in the criminal justice system is 2 weeks post-release from a correctional or residential facility. This risk of overdose death remains substantially elevated during weeks 3 and 4 post-release, but is still lower than in the first 2 weeks post-release. For example, the relative risk of death after release from a residential environment is 3 to 8 times higher during the first 2 weeks, compared with the subsequent 10 weeks post-release. This means that someone has a 3 to 8 times greater chance of dying during the first 2 weeks after release compared to weeks 3 through 12. While we focus here on the elevated risk of overdose upon release from a correctional facility, release from any residential environment where there has been mandated abstinence from opioids can represent an elevated risk of overdose. This can include release from a residential treatment program or release from a detox unit. Why does spending time in a residential environment present a risk for overdose upon release? It is likely due to a loss of tolerance to opioids. Tolerance occurs when the person no longer responds to the drug in the way that he or she initially responded. In other words, it takes a higher dose of the drug to achieve the same level of high initially achieved. This tolerance can decrease quickly when someone has taken a break from using opioids. So if someone with lower tolerance takes the same amount of opioids that he or she used to take when he or she had a higher tolerance for the drug, he or she is at risk of overdose. In Module 3, we are going to introduce you to strategies for responding to an overdose event. We will start by reviewing the symptoms of an overdose, and then we'll discuss strategies such as calling 911, administering rescue breathing, and administering naloxone if it is available. Naloxone is a medication that can reverse the effects of an opioid overdose. We must emphasize here, however, that this training does not take the place of a skills-based training that would allow you to actually practice the steps of responding to an overdose. If you are interested in attending such a training and you are currently residing in a correctional or treatment program, please see a staff member to find out if any opportunities exist for you to participate in such a training. If you are currently living in the community, your local health department may be another resource for accessing naloxone training or CPR training. Overdose is a medical emergency, so it is important that trained medical professionals assess the person that has overdosed for treatment and any potential complications. This is true even if someone on the scene was able to successfully revive the person with naloxone. Someone who has just overdosed, even if he or she has been revived, is still at risk for other complications such as heart problems or pneumonia. Also, depending on the amount of opioids he or she ingested, the naloxone can wear off and the person can go back into respiratory failure. If you do nothing else, calling 911 is essential in an overdose situation. People have died from overdose simply because the people they were with did not call 911. A person who is experiencing an overdose may have any of the following symptoms: breathing that is slow and shallow, less than 10 breaths per minute, or breathing that has stopped, vomiting, face is pale and clammy, blue or grayish lips and fingernails, pinpoint pupils, meaning pupils that are abnormally small, slow, erratic, or no pulse, choking or loud snoring noises, sometimes referred to as a death rattle, will not respond to shaking or a sternal rub, skin may turn gray, blue, or ashen. Now that we have covered the symptoms of an opioid overdose, we are going to review steps to respond to the overdose, which will begin with a review of the medication naloxone, sometimes known as Narcan. Naloxone, also known as Narcan, is a safe medication that can temporarily reverse an overdose that is caused by an opioid drug such as prescription pain medication or heroin. It works by neutralizing the opioids in your system and helping you breathe again. It is important to note, however, that naloxone does not reverse overdoses that are caused by non-opioid drugs such as cocaine, methamphetamine, alcohol, or benzodiazepines such as Xanax, Klonopin, and Valium. It should also be noted that if the person has fentanyl or carfentanil in their system, it may take more than one dose of naloxone or Narcan to revive the overdose victim. Administering naloxone or Narcan to someone is not harmful. If naloxone is administered to a person who is dependent on opioids, it can produce withdrawal symptoms. While withdrawal is uncomfortable, it is not life-threatening and is not a reason to avoid using naloxone. The shelf life of naloxone is approximately 2 years. This means that the medication, if stored properly, remains effective for about 2 years. After 2 years, the effectiveness of the medication starts to decrease, so it is important to monitor the expiration date. Naloxone should be kept out of direct light and should be stored at room temperature between 59 and 86 degrees Fahrenheit. You do not have to be a medical professional to save someone's life. Ohio House Bill 170, which was signed into law in 2014, now allows medical professionals to prescribe naloxone to a friend, family member, or other individual who is in a position to provide assistance to an individual reasonably believed to be at risk of an opioid overdose. In addition to widening the pool of people who can now carry and administer naloxone, Ohio law also now authorizes a pharmacist to dispense naloxone without a prescription in accordance with a physician-approved protocol, making access to naloxone easier.
Lisa, Lisa, are you okay? Lisa, it's Tiffany, wake up. Lisa, Lisa, can you hear me? Wake up. Lisa. Is everything okay? No, please call 911. Lisa's not responding. Okay. Lisa, stay with me, Lisa. Come on, Lisa. Lisa, stay with me. It's Tiffany, okay? I'm gonna give you some Naloxone, but first I'm gonna give you 2 rescue breaths. Lisa, open your eyes when you can hear me, okay? Lisa, stay with me, okay? Open your eyes when you can hear me. I need you to take a few deep breaths, okay? Lisa, good job. Keep breathing for me. Take some deep breaths. I need you to look at me, okay? Good job. Take some deep breaths. I'm gonna put you over in a recovery position, so I'm gonna put your arm up, and I'm gonna roll you over to your side, okay? Take some deep breaths and keep breathing for me. I also need to pull your leg up towards your chest, okay? Keep some deep breaths. Keep breathing for me, all right? Keep breathing. Help us on the way.
The first step to responding to a suspected overdose is to check the person to determine if he or she is conscious and can respond to you. You can do this by giving them a light shake and/or yelling their name. If the person seems to be responding, try to get them to wake up and focus. See if you can get them to speak. Even if they are awake, if they seem to be struggling to breathe or tell you that they are having shortness of breath or are experiencing tightness in their chest, call 911. If you don't get a response, try a sternum rub by rubbing your knuckles on their chest bone for 10 seconds. This is the place in the middle of your chest where your ribs meet. If the person does not respond to the sternum rub or their condition appears to get worse, don't try a different way to stimulate them. Call 911. At this point, you have called 911. When you are on the phone with a 911 operator, you do not need to mention drugs, but make sure to provide the basic information that emergency crews need to be able to respond quickly and with the correct resources. Give them the exact address and location of the victim. For example, if you are at a residence, give them the street address and let them know where you are in the residence. For example, on the 2nd floor, in the living room, or in the back bedroom. When describing the emergency, simply say something like, "I have a person who has stopped breathing," or "My friend is unconscious and I cannot wake them up." Step 3 is to start performing rescue breathing. First, make sure nothing is in the person's mouth. Then, tilt the head back, lift the chin, and pinch the nose. Start by giving 2 breaths. If the chest does not rise, tilt the head back more and make sure you are plugging their nose. Step 4 is to administer the naloxone or Narcan to the overdose victim. First, you need to prepare the naloxone for use. How you prepare the naloxone will depend on the formulation in your kit. 2 formulations commonly provided through naloxone distribution programs are a syringe with an atomizer and a Narcan nasal spray. We will examine illustrations of each of these on the following slides. Next, position the victim on his or her back on the floor, lifting up on the neck and tilting the chin to open the airway. Spray and administer the first naloxone or Narcan dose in the person's nostril. To assemble the syringe with atomizer, you first pull off the yellow caps from each end of the syringe. Next, you pry off the red cap from the vial of naloxone. Grip the clear plastic wings on the white cone and screw onto the barrel of the syringe. Then gently screw the vial of naloxone into the barrel of the syringe. To administer the medication, you insert the cone into the victim's nostril and give a short, hard push to spray half of the medication into the first nostril, followed by the second half of the medication into the other nostril. To use the Narcan nasal spray, you first remove the spray from the box. You then peel back the tab with the circle to open the nasal spray. From here, you do not need to do anything to assemble the spray. It is ready to use. To use, you hold the spray with your thumb on the bottom of the plunger and put your first and middle fingers on either side of the nozzle as demonstrated in the diagram on the screen. Gently insert the tip of the nozzle into either nostril. Press the plunger firmly to give the dose of Narcan nasal spray. Continue rescue breathing while waiting for the naloxone to take effect. Perform 1 breath every 5 seconds. If the person hasn't started breathing after 2 to 4 minutes and emergency personnel have not arrived, prepare a second dose of naloxone or Narcan if available. Administer the second dose of Narcan. If it is the Narcan spray, spray the second dose in the other nostril. If it is the intranasal syringe, administer half that dose in one nostril and half in the other as you did the first time. Continue rescue breathing until emergency services arrive or until the victim regains consciousness and you have signs of a heartbeat and that they are breathing. After administering naloxone and performing CPR, if the victim begins breathing on their own, put them in the recovery position, making sure to tilt their head back to keep their airway clear. See the diagram on the screen. Continue to monitor their respirations and perform rescue breathing if respirations are below 10 breaths per minute. If vomiting occurs, clear their mouth and nose. Stay with them until help arrives. Naloxone may wear off and the victim could start to overdose again. If you must leave them, even for a minute, make sure that they are in the recovery position. Remember, if you suspect an overdose, call 911, perform rescue breathing, and give the person naloxone or Narcan. If you don't have naloxone available, make sure that you still call 911.
Lisa, stay with me. It's Tiffany, okay? I'm gonna give you some naloxone, but first I'm gonna give you 2 rescue breaths. Lisa, open your eyes when you can hear me, okay? Lisa, stay with me, okay? Open your eyes when you can hear me. I need you to take a few deep breaths, okay? Lisa, good job. Keep breathing for me. Take some deep breaths. I need you to look at me, okay? Good job. Take some deep breaths, and I'm gonna roll you over in the recovery position, okay?
Module 4 is the final module of this training. Here we will discuss some next steps for those of you who want to continue to learn ways that you can help reduce the risk of overdose for friends, family, others in the community, and maybe even yourself. We are inviting everyone to continue to learn more about risks associated with the spike in deaths that has occurred in Ohio and what we can do about it. So far, you've learned about fentanyl and high-risk drug combinations, other risk factors for overdose, and the steps to responding to an overdose event. Now, we'd like to invite you to participate in skill-based training on life-saving naloxone administration and CPR protocols. To learn more about how you can help others or yourself to support recovery, and how you can serve as a resource to others who may be at risk of opioid overdose by using referral cards. We will discuss each of these in more detail on the following slides. Today's training provides a practical introduction to responding to an overdose victim, but it does not allow you to practice the steps before using them in a real-life situation. Having practiced the steps with an instructor in a calm environment makes it easier to use the steps in a real-life emergency situation. If you are interested in attending a skills-based training and getting a naloxone kit, and are currently residing in a correctional facility or residential treatment program, ask the staff if the program offers such a training or if they can provide you with information on where to attend such a training upon release. If you are residing in the community, you can check to see if there is a Project Dawn site in your community. Project Dawn, which stands for Deaths Avoided with Naloxone, is a community-based overdose education and naloxone distribution program. Project Dawn participants receive training on recognizing signs and symptoms of overdose, distinguishing between different types of overdose, performing rescue breathing, calling emergency medical services, and administering naloxone. Participants can also receive an naloxone kit, either directly or by prescription. You can check the Ohio Department of Health website on the screen for Project Dawn locations across Ohio. We described acting as a close friend or helper to others in treatment and or at risk of overdose. Another way to do that is to support participation in treatment for substance use disorders. This includes medication-assisted treatment. If you are currently in a treatment program yourself, a program clinician can help you learn more about medication-assisted treatment options during the program intake process, either for yourself or in support of others. Another way to act as a close friend or helper is to provide social support to others in the recovery process. Social support can be emotional, such as demonstrating empathy, caring, or concern, to increase someone's confidence in their recovery. Informational, such as sharing knowledge and information with others. Instrumental, such as providing concrete assistance to help others accomplish tasks like transportation or child care. And affiliational, such as facilitating contacts with other people to create community and to acquire a sense of belonging. Examples include attending sober support meetings with someone, getting involved in extracurricular sports, or engaging people with civic or faith groups. If you are viewing this video from a Talbert House program, make sure to ask the staff for a response and referral card. These cards can be carried in a pocket, wallet, or purse. An example of a card carried by staff is on the screen. On the outside of the card, one side serves as a guide for recognizing the symptoms of an opioid overdose, while the other side lists the steps to responding to an overdose. Not pictured on the screen is the inside of the card, which lists local community resources that you can use for yourself or to help someone else. These resources include phone numbers for hotlines, local Project Dawn locations, and treatment providers. Witnessing or experiencing an overdose can be very traumatic, even when the end result is that someone's life was saved. There is no way to predict your reaction after such an event as this. You may seem or feel fine and later develop symptoms hours to days later. For these reasons, we ask you to please be proactive to take care of your emotional and health care needs. If you are currently residing in a residential facility, please reach out to staff for help. If you are residing in the community and don't know where to go for help, you can call the Talbert House 281 Care Hotline or the United Way 211 hotline to find out about local resources. Remember, you have a critical role to play in the fight against the opioid crisis, both while you are in a treatment program and when you return to your community. While in the program, you can watch out for others at risk of opioid overdose, acting as a friend or ally to help reduce social isolation. If you recognize someone who is experiencing overdose, you can alert staff immediately so that they can begin the emergency response protocol. Once back in the community, you can also act as a friend to others at risk of overdose by educating them about the risks, serving as social support to reduce isolation, and providing information to them about potential treatment and health service resources that can decrease opioid risk and support recovery and wellness. You may also decide to obtain a naloxone kit so that you are prepared to respond during an overdose event in the community if one should occur. This concludes the PEER-OPS training. We want to thank you for joining us in our efforts to combat the opioid crisis, reduce overdose deaths, and save more lives.